This is USMLE QA, USMLE material presented in a question and answer format structured similar to the first aid for the USMLE Step 1 book.
Question: What is Edwards syndrome? Answer: Edwards syndrome, also known as trisomy 18, is a chromosomal disorder characterized by a variety of physical and intellectual abnormalities. Question: What are some of the findings associated with Edwards syndrome? Answer: Some of the findings associated with Edwards syndrome include a prominent occiput, rocker bottom feet, intellectual disability, clenched fists with overlapping fingers, low set ears, micrognathia, congenital heart disease, omphalocele, and myelomeningocele. Question: What is the prognosis for individuals with Edwards syndrome? Answer: The prognosis for individuals with Edwards syndrome is generally poor, as death usually occurs by age 1. Question: How common is Edwards syndrome? Answer: Edwards syndrome is the second most common autosomal trisomy resulting in live birth, with Down syndrome being the most common. Question: How does prenatal screening marker decreases in Edwards syndrome? Answer: In Edwards syndrome, every prenatal screening marker decreases. Question: What are the common physical characteristics of individuals with Edwards syndrome? Answer: Some of the common physical characteristics of individuals with Edwards syndrome include a prominent occiput, rocker bottom feet, low set ears, micrognathia, and clenched fists with overlapping fingers. Question: What is the incidence of congenital heart disease in individuals with Edwards syndrome? Answer: Congenital heart disease, such as a ventricular septal defect, is commonly seen in individuals with Edwards syndrome. Question: What is omphalocele? Answer: Omphalocele is a birth defect in which the abdominal organs are outside of the body, covered only by a thin layer of tissue. Question: What is myelomeningocele? Answer: Myelomeningocele is a type of neural tube defect that occurs when the neural tube does not close properly, causing the spinal cord and spinal nerves to protrude through an opening in the back. Question: At what age does death usually occur for individuals with Edwards syndrome? Answer: Death usually occurs by age 1 for individuals with Edwards syndrome. Question: How is Edwards syndrome caused? Answer: Edwards syndrome is caused by a genetic condition known as nondisjunction, which occurs when the chromosomes fail to separate properly during the formation of eggs or sperm. This results in the formation of an egg or sperm with an extra copy of chromosome 18, leading to a total of 3 copies of chromosome 18 in the developing embryo. Question: Are there any medical treatments available for Edwards syndrome? Answer: There is no cure for Edwards syndrome, and treatment is primarily focused on managing symptoms and providing supportive care. Medical interventions may include surgery to correct certain physical abnormalities, such as a ventricular septal defect, and therapy to help with intellectual and developmental delays. Question: Are there any support groups or organizations for families affected by Edwards syndrome? Answer: Yes, there are several support groups and organizations available for families affected by Edwards syndrome. These groups can provide information and support, as well as connect families with other families who have a child with Edwards syndrome. Question: Is there any genetic testing available to detect Edwards syndrome? Answer: Yes, there are several genetic tests available to detect Edwards syndrome, such as chorionic villus sampling and amniocentesis. These tests are typically done during pregnancy to diagnose Edwards syndrome in a developing fetus.
Thank you for watching our Q&A format video. We hope this helped you learn, review, and retain knowledge needed for the USMLEs. For more information on this topic, check out the link in the description. Now, if you want to take your USMLE prep to the next level, be sure to check out all our courses, which are structured to follow along with the first aid for the USMLE Step 1 book. You can find us at usmleqa.com. And if you're watching this on YouTube, be sure to like and subscribe.